substantially raised premiums for older workers. And that is why, among other groups opposing the House bill, the AARP made the point that this would be a disaster for older workers. The truth is, Mr. President, this is not a health care bill. This is a tax break for the rich and multinational corporations bill. This is a bill that would provide over $200 billion in tax breaks to the top 2%. This is a bill that would provide hundreds of billions of dollars in tax breaks for the drug companies and the insurance companies. Last information I received, pharmaceutical industry, the major 5 drug companies made over $50 billion in profit. But this legislation would throw Americans off of health insurance to give the drug companies even more profit. This legislation, the House bill, and I think similarly the bill being worked on behind closed doors, is not only opposed by the AARP, the largest senior group in America, it is opposed by the American Cancer Society, by the American Heart Association, by the American Lung Association, the Cystic Fibrosis Foundation, the March of Dimes, the National MS Society, the American Medical Association, because the doctors know what a disaster this will be for health care for millions of Americans, the American Nurses Association, and the American Hospital Association. So you got all of these groups who are the pillars of health care in America saying, no, no, this is a disastrous bill, and yet we have the Republican leadership and a dozen or so members working behind closed doors. Now, Mr. President, nobody here has suggested that the Affordable Care Act should not be improved. In my view, it should be improved. In my view, deductibles are too high, co-payments are too high, premiums are too high, and certainly the fact that we're paying twice as much as any other country for prescription drugs, that has got to be dealt with also. So the task right now among sensible people is to put on the table and to be honest about it. What are the problems of the Affordable Care Act? How do we lower deductibles? How do we lower co-payments? How do we control escalating costs of health care? Those are reasonable questions that honest people should debate. But the answer is not to throw 23 million Americans off of health insurance. That is not a solution to the problem. That is an insult to the American people. Let me just conclude by stating this. Our job right now is to make sure that this disastrous Republican proposal never sees the light of day. And I would urge my Democratic colleagues, on behalf of the American people, the vast majority of whom know how bad this legislation is, that we have got to stand up and fight in an unprecedented way to make sure that that legislation never sees the light of day. And after we win that struggle, I would hope that we would come forward as a nation and join every other major country on earth, whether it's Canada, and I live 50 miles away from the Canadian border, whether it's the United Kingdom, France, Germany, that we would join every other major nation on earth and say that health care is a right of all people, not a privilege. If you are an American, you are entitled to health care. You should not be one of the 23 million people thrown off of health care, bringing the total of uninsured in America over 50 million people. That is outrageous. So, Mr. President, I think you're going to hear the American people stand up loudly and clearly, demand transparency, demand serious debate on an issue of this consequence, and I think at the end of the day, this legislation will be defeated. Thank you, and I will yield the floor.
Mr. President.
Senator from Washington.
Mr. President, Democrats come to the floor this evening as a voice for the people that we represent, to fight back against Republican plans to jam Trump care through this Senate, increase health care costs, and hurt families across the country. Because Republican leaders may hope nobody pays attention, They can hope they can go into these secret rooms and cut secret deals and come out with a Trump Care bill that they can jam through before anybody notices. We are not going to allow that to happen. We are here. We're going to fight back, and I can only hope that just a few Republicans decide to listen to their constituents, reverse course, and work with us to improve health care instead of standing with President Trump to destroy it. Mr. President, I want to start by talking about a constituent of mine whose story I heard and whose voice and perspective should be a part of this debate. Her name is Lisa. She's from Spokane in my home state of Washington. Lisa served our country in the Navy for 6 years. She goes to school. She works part-time. She says she relies on Medicaid to afford the health care she needs, and she is very worried that if Trump Care passes, she would not only suffer from cuts to Medicaid, but she could lose her coverage altogether because, like many Americans, she has a pre-existing condition, asthma. Lisa is not alone. There are millions of people just like her in Washington State and across this country, and each of them, every patient, every family, has a stake in this fight. They deserve to be a part of this debate, and they have a right to know how Trump Care would impact them if it's signed into law. Mr. President, that shouldn't be a partisan sentiment. I've heard Republicans come to the floor time and again, demanding transparency, railing against secrecy, calling for hearings. One Republican senator, who is now the chairman of the Senate Health Committee, came here to the Senate floor back in 2009 to blast Democrats for writing an amendment, quote, in secret. He said, and I quote, "None of us on the Republican side knew what was in it," and he accused Democrats of trying to pass our bill, quote, "before the American people find out what's in it." Well, Mr. President, my friend, the chairman of the Health Committee, is certainly not alone. Back then, the current Republican majority leader said, and I quote, "This is a massive piece of legislation that seeks to restructure 1/6 of our economy. It's being written behind closed doors without input from anyone in an effort to jam it past not only the Senate, but the American people." Well, Mr. President, that was not true back then. We held dozens of bipartisan hearings and meetings over months and months and months. But it is what Republicans are doing right now. The chairman of the Senate Health Committee, who I respect and would never think he would be a part of an effort like this, told me he was not planning to hold a single hearing on Trump Care. The chairman of the Senate Finance Committee, where a lot of work on this bill should be getting done, told my friend the senator from Missouri he wasn't going to hold a hearing either. There are reports now that Republicans actually have a text of their bill. Something is written and almost ready. Democrats don't get to see that bill. People across the country are being kept in the dark. Republican leaders are treating it like President Trump's tax returns and not allowing it to see the light of day. It is absurd and it is unprecedented. We could be just days away from a massive bill being jammed through this Senate, and many Republican senators are telling press and constituents they couldn't even say what was in the bill if they wanted to, because they haven't seen it either. This bill is so secret, even President Trump's top health advisor, the Secretary of Health and Human Services, told us in a hearing last week he hasn't seen how Trump Care is being changed in the back rooms of the Senate. So, Mr. President, let me ask this. Why are Republican leaders so focused on keeping Trump Care work secret? Why are they keeping it locked down so tight and not letting people see what's even in it? What are they so ashamed of? Well, one Republican Senate aide was quoted defending this secrecy by saying, and I quote, "We aren't stupid." In other words, Republicans know it would be, quote, stupid to put this bill in the public, because they know that people across the country, the people they are supposed to represent, would hate it. That explains a lot. Republican leaders, those who are writing this Trump Care bill in secret, know they would not be able to go back home and defend it. They know the more people learn about what's actually in it and what the fine print might mean for them and their families, the more people back home are going to rise up and fight back. So they want to keep it wrapped up tight, under lock and key, no hearings, no scrutiny, no public input. When they first announced their secret working group, not even any women were in it. Republican leaders are in their back rooms desperately trying to cut those final deals, doing whatever they can to bully those last few Republicans into supporting something they know their constituents will hate. But, Mr. President, we're here tonight to say enough is enough. This has got to end. Health care is too important, and Trump care would be too devastating to allow this kind of secrecy to continue. Mr. President, we don't know exactly what is in Trump care bill being written in secret, but you know what? We have a pretty good idea. No matter how much lipstick they put on this pig, based on everything we have heard, this is going the same way Trump care went in the House, and the impact on patients and families would be just as bad. Higher costs for families, especially seniors and people with pre-existing conditions. Higher costs. Insurance companies no longer required to cover basic health care, you know, things like maternity care or mental health services and much more. Women would lose access to see their doctors and the care they need at Planned Parenthood, and millions of people across the country would see their Medicaid coverage taken away. That means people nationwide who are finally getting treatment for substance use disorders like opioid addiction or mental health care or access to a primary care doctor under Medicaid are going to lose that access. Mr. President, this would be so devastating for families across the country. Over the past year, I've met so many families in my home state who've lost a loved one to the opioid crisis. In Bellingham, in Spokane, community after community, the story is always the same. I've heard directly from people on the path to recovery, like Tyler in Yakima or Michelle in the Tri-Cities, who told me how getting treatment changed their life for the better. Mr. President, I couldn't imagine any senator will want to go home, look in their constituents' eyes, and tell them they helped pass a bill that would take away the tools those communities need to fight this crisis. But that is what my Republican colleagues are planning to do as we speak. And let's remember, all of this damage would be done, why? To give a massive tax break to special interests in the health industry and hand President Trump a hollow political win. Mr. President, it is truly shameful and it needs to stop. Last week we learned President Trump is now saying that the House bill is, quote, and I quote him, mean. Mean. Well, that is certainly an understatement from a president who doesn't often do subtlety, and it's pretty surprising to hear after we all saw him celebrate the House bill at the White House when it passed. But here's the truth. The House Trump care bill isn't just mean, it is devastating. And the Senate Trump care bill is going to be just as bad no matter how they try to spin it or how many side deals they cut to claim it's changed. So, Mr. President, I have a message for Senate Republicans who are so ashamed of what's in this bill that they're keeping it secret. It is not too late to change course. It's not too late to bring this process out from the shadows. It is not too late to be honest with people across the country about what you are doing. It is not too late to listen to the voices of people like Lisa. It's not too late to abandon this plan to jam Trump care through Congress. And if you do that, if you stop, Democrats stand ready, as we always have, to work with you to actually make health care more affordable and accessible for patients and families across the country. Mr. President, people across the country are watching. They are paying attention to this. They are not going to allow Republicans to slip this through without any scrutiny. And we Democrats are here to say loud and clear, we're going to keep fighting to make sure they have a voice. Thank you, Mr. President. I yield the floor.